Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Navigating the healthcare system can be overwhelming, especially when you're facing a rare disease diagnosis, a medically complex child, or unanswered questions that don't fit neatly into a common diagnosis. On this podcast, we bring together experts, advocates, and individuals with lived experience to help patients and families become informed, empowered participants in their healthcare journeys. So today, I'm honored to welcome Jordan Kruse, founder of the Brave Little One Foundation. Jordan's advocacy journey began after her son, Pruitt, was diagnosed with a rare condition. I'm going to let you pronounce it, actually, because I'm probably going to chop the word.
Most people don't even attempt to pronounce it and just say OTC deficiency, but it's ornithine transcarbamylase deficiency.
That's exactly what I'm used to. And I'm like, I don't know how to say the long version. But this is a rare genetic metabolic disorder that can cause dangerous ammonia levels that build up in the body. So after losing Pruitt just 6 months, it's just 6 months old, Jordan transformed unimaginable grief into a mission focused on education, support, and awareness for families facing rare diseases. Through the Brave Little One Foundation, she helps families navigate medical hardship, provides adaptive clothing for children with feeding tubes through Pruitt's Closet, and advocates for earlier recognition of rare conditions. So, Jordan, I am honored to have you here today. Thank you so much for joining us.
Yeah, thanks for having me.
Of course. This is a true amazing thing that you're doing. I have a son with a chronic condition, and at a younger age, we struggled a lot with certain things. So I can definitely appreciate even more and relate to all the advocacy and efforts that you're doing. So before we talk about advocacy and awareness, I'd love for our listeners to get to know a little bit about your son. So tell us, if you don't mind sharing a bit about him.
Yeah, absolutely. So Pruitt was our third child. He's got two older brothers. He was born in May of 2024 on the last day of school. I'm a teacher. We were blessed to have him for 6 months. And in that 6 months of time, it was difficult, but he brought us so much joy. He was a fighter. He was strong. He was brave. We all knew that he'd have a little bit of spunk to him because he had this little side eye that he'd give us. But he was the sweetest. We only had him for 6 months, so I didn't really get to learn like a huge personality from him. So there's not a lot I can share there. But out of all the babies, despite his medical condition, I would say he was the most easygoing, I think, out of the three. So
now we'll get into it a little bit more, but did you know that he had this condition at birth, or was it something that was missed?
Yeah, so he was born the 17th, and then he got discharged from the hospital the 19th. And that was probably around like noonish, like around lunchtime.
Mm-hmm.
And so he had a circumcision that morning.
Mm-hmm.
And so we were told that if he doesn't urinate, to bring him in, because that can be signs of
like a side effect.
Yeah, side effects from the circumcision. So we did end up bringing him into acute care just before they closed because we were concerned because he hadn't urinated. He was eating. He was like, there was no other like at that point tellers or concerns. So we got him checked out. And that was close to like, I think they closed between 9 and 10 p.m. I can't remember off the top of my head. And he checked out. So we got sent back home, and we got home probably between 10:30, 11 p.m. And because our hospital is about a half hour away from where we actually live. So at least it's pretty close. And then things just kind of, once we got back home, started to go downhill from there. He started to refuse to nurse, which was, and I had breastfed all my boys, so I kind of was a little worried about it. So then we tried offering him a bottle, and he was refusing that too. And then he started having like uncomfortable breathing noises. It didn't sound like he was in respiratory distress by any means, but more so like maybe like gas buildup or, just tummy issues. but it continued. So then we're like, okay, we should probably bring him in. And so we did. And at that point, he just, I don't know, everything just kind of went so quickly and so fast, all of the things that were going on. So they treated him for sepsis-like symptoms.
Yeah.
And so they were thinking it was an infection of some sort. And it wasn't till, and then we got admitted, and it wasn't till the 22nd, I think, that they started thinking, okay, maybe it's something genetic,
Wow.
metabolic.
Yeah.
And that's when they ran an ammonia test. So, no, we did not know of this condition until he was diagnosed. And turns out I was the carrier of this condition, and I've just been asymptomatic my whole life because I'm a woman, and I typically they present less severe with women than they do with males.
So
Yeah.
many of our listeners, they may not, they may have never heard of OTC
Mhm.
deficiency. Can you explain what it is and, a little bit about how it affects your body?
Yeah, so essentially it's a type of urea cycle disorder, and it's actually in the rare disease community, even though it's rare, it's of the urea cycle disorders, it's the most common. And so essentially it just means that when you have this condition that it affects the body's ability to remove ammonia, which is a waste product created when we break down protein. And obviously, we know that protein is essential to survival and growing. So we need protein to survive. But with Pruitt's condition, too much protein can be detrimental. And so in OTC deficiency, one of the key enzymes in the urea cycle is either missing or not working properly. So when that enzyme isn't functioning, that ammonia can build up in the bloodstream, which is extremely toxic, especially to the brain.
Sure.
And it can lead to like a range of symptoms, and it varies widely depending on severity of the condition and then age of onset. So, like for infants, it can show up like Pruitt's case very
Mhm.
quickly and look like sepsis and become life threatening. In children and adults, it can look a little bit more like a little different. It might be milder, but also still very,
Sure.
detrimental. But it presents mild to moderate, typically with your later onset forms, and it almost might look intermittent. So like things like episodes of confusion, extreme fatigue, headaches, behavioral changes, sometimes vomiting, or difficulty like tolerating those high protein meals. So it can make it very challenging to, especially in those children and adults, to get diagnosed because they can be confused for stomach viruses or a neurological problem before they realize that it's something metabolic. But yeah, it's a condition that requires constant attention and a very carefully controlled diet and strict medications, and always have an emergency plan in place. But it can look so different for every individual.
And I think that makes it more challenging to identify, right? Because
Mhm.
it's not specific symptoms. Um,
Yeah.
so a question that I know a lot of our listeners probably have, is this something that is included in like the general newborn screening?
So OTC deficiency is not in the newborn screening. From what I've learned from other people that advocate for the disease, is that it's
Mhm.
just a very tricky test to get like accurate.
Sure.
So there's like a lot of moving parts. So it is not part of the newborn screen, but there are other urea cycle disorders that are on the newborn screen.
Correct. Yes. Yes. And I am familiar with those. I think it's important to point out because, especially as like new moms and things like that, people will
Mhm.
say, well, the child's newborn screening is normal, so everything must be fine. And while they do screen for a lot of things, and it keeps changing throughout the years, I think it's important to know, like, one, I think that like motherly instinct is
Mhm.
hugely undervalued. And I think like,
Mhm.
regardless if you're a new mom or you've had multiple children, if you know your child, like even though they haven't been alive for very long,
Mhm.
something's wrong. If you feel like that, you know, take them in and like you
Yeah.
did, because it's better to get it checked out, number one. But number two, there's it's impossible to check for everything, right? And
Yeah.
so
And even with newborn screens, like sometimes they don't come back in time.
exactly.
So
Or
you
they could
can't
be wrong.
rely. Yeah, it could
Yeah.
be. Yeah,
Yeah.
absolutely.
So your advocacy message is incredibly powerful, and it's think rare, act fast. What does that phrase mean to you?
Well, for like Pruitt's situation, they, and I'm not faulting hospitals by any mean, because this is what they're trained to do, is to look for the common
Sure.
explanation, look for what's right in front of you. But the think rare piece is just like, don't just assume
Hmm.
that it's like in Pruitt's case, they assumed because
Sepsis.
his
Yeah.
symptoms look like sepsis, they were going that route because it's far more common than obviously other things. So that's the route that they took. And in Pruitt's case, that was very detrimental to the brain damage that he
Oh
ended up
no.
having because we had that delayed ammonia testing. So like the act fast piece is more so, I would say, testing for that ammonia sooner. So I'm really trying to push for quicker
Not being
ammonia
scared to
testing.
ask
I mean,
questions.
you're already testing and, given array of labs and stuff already. One
Sure.
more lab draw isn't going to hurt the baby by any means. So just take that test. The worst that's going to happen is it says it's going to give you an answer or it's not.
Yeah.
So it's not going to hurt to take that ammonia test. So it's so quick when the ammonia builds up, and the delays lead to irreversible brain injury within
Yeah.
hours.
I can
So,
I can relate to some extent. My son, when he was 2, he had a septic hip, and they were just kind of brushing it off because he didn't look. His labs didn't look as sick as he was. So when I brought him in emergently, they were kind of like, "Oh, we're gonna wait," and I'm like, "No,
mhm,
something's wrong with it. Like he needs, I know something's wrong with him. Like something's wrong."
yeah,
And so they delayed the surgery by 5 days, which he would have died, honestly, because he was so septic by that point. As a result, he ended up having like part of his bone died. So he had necrosis of his bone. So he got avascular necrosis of his hip, which is kind of affecting him lifelong now. I mean,
yeah,
he's, improved, but, you know, again, of course, people follow algorithms and things, but I think there's, like I said, there's a huge value in just the mother's instinct and also just doing the extra tests because that's what they're
yeah,
for, right? The delay, even if it's a couple hours or a day or days, it can have a lasting impact, right?
yeah,
So I think that's hopefully something that we like stress in the medical field and it
yeah,
becomes, improved.
yeah. And like our hospital that we had Pruitt at, they've actually changed protocols
That's
because of
perfect.
him. And so now it's part of their sepsis screening. So, I mean, I just really hope that more hospitals will get on board for that and not have to have a situation like Pruitt to happen
Exactly.
before they make the change. I want that change to be made prior
Yeah.
to a baby, coming in. And I mean, the chances of them having this rare disease is, you know, very minimal,
But if you catch it, like you're
but if you
saving a
catch
life,
it,
right?
yeah.
Yeah, for
I
sure.
mean, and I just, it's something that I always think of is like how many babies die and it goes unknown.
Unnoticed or unheard or undispatched.
Yeah. So,
Yeah.
like, I mean, you
Yeah.
see
I
the
think that's
statistics and stuff, but, there's ones that just go completely undetected
And it's so
too.
important to speak up, I think, because, and I commend you because I think when something dramatic like this happens, a lot of people shut down, which is a natural response. So the last thing anybody wants to do is kind of get that energy to make a difference. So the fact that you're able to do that is amazing because you're helping so many people.
Thank you.
So many patients, like kind of my next question sort of leads into what we were just talking about, but or follows up with it. Many patients don't just choose advocacy, it kind of chooses them. How did your experience caring for Pruitt shape your understanding of patient and caregiver advocacy?
Like, I don't really know when that exact moment, like, truly happened of, like, of, like, how it necessarily shaped me, but, like, when you are thrown into these situations, you're almost, like, just, like, thrown into deep water and expected to swim,
Fight or
And
flight, yeah.
you learn as you go, like, I mean, I definitely was not perfect at advocating by any means. I remember, like, the first early stages of being in the hospital, and there were so many unknowns, and at that point we didn't have a diagnosis and stuff, and there were just so many people in the room caring for Pruitt. So like I feel like at first I was kind of, you know, a step back because I didn't want to be in the way. I didn't want to like get in the way of the doctors and the nurses who I felt like were trained and were more knowledgeable than I was to be, you know, by any means. But as time went on, I feel like I started to learn that like I needed to step up and start asking questions, learning his care. Like I was just always so worried at first to be like step on their toes and get in the way,
Sure.
when in reality, like at the end of the day, I there's nothing wrong with me asking the question and questioning decisions that they're making. And you know, you'd have rounds in the morning, and that was like our time of like them educating us on what the plan was for the day. And I learned like quickly that okay, I don't have to stand there and just be quiet and listen. Like this is for my child. I can ask questions even if I sound like a complete loser with the questions that I
100%.
have. But just stepping up and just asking the questions and not being afraid of getting in the way, I feel like is just like very important. And I think a lot of moms probably feel that way too, like that they're nervous because they
Sure.
don't feel educated enough because you're in a completely different world.
Yes.
You're
No.
learning medical language that you had not known prior to the experience. So,
I also think too, with communication is, no matter how much healthcare systems try, it's not perfect. There's no
no.
perfect communication situation.
Mhm.
And with you being an involved parent, like you kind of help bridge that communication gap. So
Mhm.
like during the rounds, because there's so many people coming in, so many different teams,
Mhm.
even if they're writing notes or talking to each other, not everybody is doing that. There's going to be something that's like overlapped, or,
Yep.
something that's ordered that the other person doesn't know, or some test that came back, so you being there being like, no, this actually happened, or clarifying it or asking it is
Yeah.
helpful.
And like I was kind of the fish out of water in the situation because like Chris is my husband.
Mhm.
Like he teaches biology, he's into the science, he does host stuff for a living. So like he has like
He
some
knows, yeah.
like he understands terms better than I
Mhm.
do. Like he can just pick up things. And then his mom was present too, and she works at Sanford in a completely different department and stuff,
Mhm.
but like she knew things. So
Yeah.
it would like I'm grateful that they did because they picked up the slack that I didn't understand. And if there was something that I wasn't quite
Mhm.
sure about, like I could ask them and they
That's great.
typically knew. So it was really helpful too to just have those two put the pieces together that I maybe didn't understand because it came a little bit more difficult for me.
Yeah.
So,
No, that's amazing. I make that makes total sense.
yeah.
So I know that this may be difficult to discuss, but your willingness to share your story has already helped so many people. After losing Pruitt, what helped you begin navigating that grief?
You know, like in the very, very early stages of grief, like I think back, like at the time, feel like I was just in like survival mode.
Yeah.
Um, but like I mean, in the US, as you've noticed, like we don't get a lot of bereavement leave.
Oh yeah.
You get your 2 weeks and you're back at work. And in some ways, I think was good for me
Because it keeps you busy.
because it kept me busy and I wasn't able to completely wallow all day long.
Mhm.
So I think that was part of navigating it. It was being kind of forced back into work. But also, I got acquainted with a group that I joined, and it was wonderful. It was with other lost moms who, lost a child. So their circumstances were obviously different than what Pruitt's were, but we all had the same common denominator that we lost a kid. So I felt like that definitely helped in some ways to just talk with other lost moms and lost parents. And it made you feel kind of like less crazy for the thoughts that you were having and less alone. So I definitely feel like that was a big tool in my chest at that time to have those people. And I still talk to some of those individuals that were in that group. I don't go to grief group as often as I used to, but I feel like I'm navigating it a little bit more differently because I'm not in that survival mode anymore.
Sure.
I mean, it's been almost 2 years now. In November, it'll mark 2 years since we lost him.
I'm
So I'm still a baby in this grief in comparison to other parents that I, have
Sure.
talked to going through this. So I'm still learning, and it's different for everybody. And that's one thing that I feel like the grief groups have helped me, is making me realize that every single person responds to grief differently, and there's no right way to go through it. And
That
I
makes
just,
sense.
yeah.
That's a
So
very good message.
I don't know, but now I feel like the foundation has helped me kind of manage it. And, we're a camping family, and I just think being outside in nature has also been kind of therapeutic in its own way too.
Nice.
So, yeah.
So you're a teacher, you mentioned, and
Yeah.
many parents describe their children as their greatest teachers. And as a parent myself, I would actually very much agree.
Yes.
So what lessons did Pruitt teach you and your family?
Yeah. So, I mean, and I think this is probably for any medical parent. They probably can agree with this lesson. It's to just be present. You
Sure.
don't know what time you have with your kids, with your family, with your friends. So it's just like, I feel like the biggest thing I took away is just like the living in the moment and not just assuming that tomorrow is guaranteed, because it's not. And then being brave. I mean, there's so many instances that I had to put on my big girl pants, and be brave. And anytime that I like get into a situation now that I'm like, oh, I don't know that if I can do that,
Mhm.
I do feel like I can now, because he went through so much. So if he can go through that,
Yeah.
I can go through this. I can suck it up
Oh, that's great.
and
That's a
do
great message
the
that you
hard
always have.
things. So
That's wonderful.
Yeah.
No, that's a great lesson to keep with you.
yeah.
So, Jordan, I'm sure our listeners would love to know more about your work and are curious about how they can connect with you and your foundation. Where can people find more information about you and what you're doing?
Yeah, so we have a website, the Brave Little One Foundation. And then we're also on Instagram and Facebook.
Perfect.
And so they can reach out to us through there. All our contact information is
Yeah,
on
we'll
our
share that as
website,
well
so
in the
they can
notes.
find, and then all our like Facebook and Instagram handles are on our website as well. So
That's wonderful. Well, Jordan, thank you for sharing your family story with such honesty and courage. Advocacy is helping raise awareness, educate healthcare professionals, and support families who may feel alone during some of the most difficult moments of their lives. I really hope that this conversation has helped our listeners feel more confident as they navigate their healthcare journeys. Thank you so much, Jordan.
If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.